On the east side of Indianapolis,
we would use an ultrasound to find the pregnancy, make sure that it was in the uterus.
Dr. Katie McHugh preps for a full day of patients.
We're seeing about 30 to 40 patients a day here, and probably a third to a half of those patients are from out of state, the majority of which are from Kentucky and Ohio.
Dr. McHugh is an OB/GYN who grew up in Indiana, went to school in Kentucky, and in recent months says her work has exclusively focused on abortion care due to the high demand.
I was sitting in the office when we all got the news, and immediately the phones rang off the hook. Immediately we had a wait list because while Indiana did not have a trigger ban, both Ohio and Kentucky did.
She says they extended clinic hours just trying to meet the need.
Patients suddenly were flocking to Indiana.
And then news from the Indiana State House.
The bill has passed. So I thought the bill remained the top of the act.
Indiana lawmakers crafted new restrictions and passed them, criminalizing abortion in almost all cases.
Kentucky and Indiana are among the worst in our country for both maternal and infant mortality, and then we force people to continue a pregnancy against their will. It is very traumatic to think about the impact that these bans are going to have.
According to the latest data available from the CDC, Indiana has the 9th highest infant mortality rate in the country. Kentucky is 13. Ohio also in the top 10. In maternal deaths, Indiana is the 3rd highest in the country. All of those states now have abortion restrictions.
Women will die as a result of this.
Planned Parenthood groups in these states are now working with women in different ways. The Kentucky chapter's focusing on facilitating access.
Right now, that looks like having patient navigators whose sole purpose and responsibility is to communicate with patients and help them navigate safe pathways to care in other states.
And as an abortion provider, Dr. McHugh is also changing course.
Indiana and Kentucky and Ohio and many of our neighboring states have decided that people should not be able to decide their own future or be able to say what happens to their own bodies. I can't work in a situation where that is the case. So I will be moving my practice, at least the part of my practice that provides abortion care, and doing that in a place that is legal.
Next stop, Illinois. She says most of her patients can't afford to fly to access an abortion, so they drive, and Illinois is the most accessible.
This is not demonic work. This is compassionate, safe healthcare that is based in science and evidence and decades of research.
Across state lines, she plans to continue providing care, even when that care comes at a cost.
My physical safety has been threatened. I've had people contact me with pictures of my kids' schools. It is a dangerous path, but it is so important.
In Indianapolis, Shay McAllister, WHAS 11 on your side.